I'm Dr. Streicher, and your question is, what is menopause? I'm going to give you the inside information. Basically, menopause is when your estrogen tank is on empty. Your ovaries are either no longer producing estrogen or they've been surgically removed. Now, medically, the standard definition of menopause is when a woman stops getting her periods. And a woman is considered to be postmenopause when she's not had a period for 12 months. Now, the term perimenopause, which of course you've heard, literally means around menopause. And that begins with the onset of irregular periods or other menopause-related symptoms. Your hormones are up and down and all over the place and extends until someone has not had a period for a full year. But these definitions, they're kind of meaningless for women who don't get periods. And there are a lot of women who don't get periods that have nothing to do with menopause. So, for example, a lot of women have a progesterone IUD. Women with progesterone IUDs very often don't get periods, even though they're still making plenty of estrogen. Women who've had an endometrial ablation, a procedure that basically destroys the lining of the uterus to get rid of heavy bleeding, they don't have periods. They're still making estrogen. And then women who've had a hysterectomy don't get a period, even if they still have functional ovaries. And the list is long of reasons that women don't get a period that have nothing to do with menopause. So you can't always use getting a period or not getting a period as your parameter for when you're in menopause. Because what menopause really is not whether you get a period or not. It's when your ovaries permanently stop producing estrogen. And that can occur spontaneously. It can be a result of chemotherapy, medication, or surgery. The other thing that makes it kind of complicated to really pin down what menopause is not every woman in menopause has obvious symptoms. And in fact, 20% of women have absolutely no symptoms at all. And their only tip-off is a lack of periods. So it can be very confusing, but certainly there are a number of different things that we can do, sometimes blood work, sometimes just based on history and exam, to really determine if in fact someone is in menopause. Now, I know you already know this, but I'm just going to mention, once someone's officially menopausal, she can no longer spontaneously get pregnant, unless of course she's doing fertility treatment using a donor egg. And I just want to clear up the idea of that it's the running out of eggs that make women go into menopause, because this is a huge misconception, is this notion of when you run out of eggs is when you go into menopause. And it's simply not the case. Women are born with an insane number of eggs, between 1 and 2 million. And even though women do lose eggs throughout their life, by the time they enter menopause, they still have eggs left, usually on average about 300 to 400, but they're not good eggs. They're old eggs. They're useless eggs. They're not viable eggs. So there you have it. Menopause, bottom line. What does it mean? It means your ovaries are out of business, or you no longer have ovaries and you are no longer producing estrogen. So now that you know what menopause is, please check out my other videos and articles for more information and really to do the deeper dive into how to deal with the fact that you no longer have estrogen.